Dear students, welcome back. In the previous session, we have discussed about electric shock. Now, in this session, we are going to discuss about a new topic that is electrical stimulation of nerve and muscle. So, normally, the muscle which are connected by the nerve, that is spinal nerve, and the spinal nerve carries sensory information through sensory nerve, and after it reaches to the spinal cord and it reaches to brain, from the brain, after interpretation from the brain, and it is carried to the again the spinal cord on the anterior horns where the motor neurons are getting originating. So the information is transmitted to the muscle, whether the muscle has to contract or relaxed. Okay, so that means the muscle and the nerve are connected together to perform a coordinated action. Okay, yes. So normally to stimulate such kind of nerve, what it is going to do on the muscle? Okay, if nerve is absent, is the muscle is going to contract. That means the nerve supply is not present. So then, is that muscle is going to work or not? Okay, all these things you people can get clarity after this session. Okay. A current which varies sufficiently in magnitude can stimulate a motor nerve, which it supplies. While in the absence of motor nerve, the muscle fibers can be stimulated directly by a suitable current. Okay, intermittent currents are used in both cases, and a considerable range of such currents is available. Okay, so the duration of current used ranges from 0.01 milliseconds to 3 seconds. The equipment now commonly provide durations from 0.01 to 300 milliseconds. That means the equipment will have 0.01, 0.03, 0.1, 0.3, 1, 3, 10, 30, 100 and 300 milliseconds. Impulses with a duration less than 10 milliseconds may be classed as having a short duration and which are used for stimulating normal innervated muscle. Okay, such impulses are said to be Faradic type. The repetition rate of the impulses is great, usually 50 to 100 per second. 50 to 100 per second. Okay. So, for innervated muscle, the current required to stimulate to innervated muscle is by the Faradic type. Okay. Impulses with a duration of less than 10 milliseconds are called as Faradic type. Okay. So now, impulses with a duration of more than 10 milliseconds may be classified as a long duration and are used for stimulation of denervated muscle. That means the muscle is not supplied by the nerve. So for example, if you take this one is denervated muscle, so already it is connected with some sensory nerve, so it is not supplied by any nerve. this muscle can be directly stimulated. This muscle can be directly stimulated by such kind of currents or such kind of impulses with a duration of more than 10 milliseconds. Such type of impulses can stimulate the denervated muscle. So these are oftenly called as interrupted or modified direct currents. What you can say? These are commonly called as interrupted or modified direct currents. Okay, of course Faradic also interrupted direct current, but it is having short duration, and this interrupted or modified direct currents is also called as galvanic type of currents. Okay, the impulses are repeated less frequently than those of short duration. For example, for impulses lasting 100 milliseconds each, then a frequency of 30 per second can be obtained. 30 per second can be obtained. Whereas in the Faradic type, we'll get 50 to 100 per second. Okay. These are the different types of impulses which can stimulate denervated muscle and innervated muscle. So if you see the innervated muscle, so the type of current used is Faradic type of current, which is a short duration interrupted direct current with a pulse duration of 0.1 to 1 millisecond and a frequency of 50 to 100 hertz. Okay, this is called as Faradic type of current. This one can stimulate the innervated muscle. That means it also stimulates the nerve also. Okay. So already we have discussed about how this Faradic type of currents are obtained. Okay. And through some different coils. Nowadays these coils are replaced by some inbuilt circuits like multi-vibrator circuits in electronic stimulators. So these electronic stimulators will supply currents which produce the same physiological effects as the original Faradic currents. Okay. Although often differing considerably from them in waveforms. So normally we have seen the original waveform of Faradic current is somewhat modified. So we can see the original one. Already we know that the original one comes like this, isn't it? So a long duration and short one. Okay, here the Faradic type current from modern stimulators, we can find such kind of waveforms here. Okay. So and for this modern electronic stimulator also, the main feature essential for the production of these physiological effects are that impulses with duration of 0.1 and 1 millisecond is required and repeated to 50 to 100 times per second. Okay. The electronic stimulator for the production of Faradic type current works on the same principles as that of the interrupted direct current. But the resistances controlling the duration of impulses and the intervals between them have a very low value to give the required duration and a repetition rate. So for that reason, the Faradic currents are modified for treatment. So the Faradic, here you can see different forms of modified Faradic currents. Faradic type currents are always surged for treatment purposes to produce a near normal tetanic contraction and relaxation of muscle. So here this first pic you can see the unmodified current. The current is surged so that the intensity of successive impulses increases gradually, each impulse reaching a peak value greater than the preceding one. So here you can see this is the varying type. So if you can see the starting impulse, and next impulse is again greater than the first, and third, fourth, every impulse is going to increase there. Okay, so we have to apply such a kind of we have to modify the Faradic currents in such a type to get therapeutic effects. Okay, and so afterwards, next another one. So the preceding one is always the next one is greater than the preceding one, then falls either suddenly or gradually. Okay, so in the original Faradic coils the current was surged by hand, but in modern stimulators an electronic device is used. The circuit can be modified to give surges of various durations, frequencies and waveforms. Here you can see different types of waveforms. Okay, so this one is current in surges, different surges here. Here you can see the varying interval between the surges. In the first in this graph you can see small intervals between them, and in this graph you can see greater interval than this one. And here the current in different surges we can give. Here we can find different waveforms. It is desirable, such kind of waveforms are desirable, that the duration of the surges and the intervals between them should be regulated by separate controls in order that the most satisfactory muscle contractions and rest periods can be obtained for each patient. Okay, various forms of surge may be available corresponding to trapezoidal type, triangular type and sawtooth type of impulses, and that most suitable for each patient must be selected. Okay, so these are the modified Faradic currents which are used for the stimulation of the innervated muscle, that is, so the nerve is also going to stimulate, as well as from there the impulse is carried to the muscle. Okay, so now we are going to see the transmission of a nerve impulse. Okay, how it happens. So what is the type of current we have to use for transmission of nerve impulse? Faradic type is required. Okay, now we can see here in the nerve transmission, always when a nerve fiber is in resting state, there is difference of potential in the outer and inner surfaces of the plasma membrane. Normally the outer surface bears positive charge, okay, and the inner surface bears the negative charge. in the resting period. During resting period, outer surface bears positive charge and inner surface bears the negative charge. In this state, the plasma membrane is not permeable to sodium ions. These positive ions accumulate on its outer surface, and there is an associated arrangement of other ions following a definite pattern inside and outside the membrane. Okay. Once this potential difference across the membrane falls below a certain level, the membrane becomes permeable to sodium ion. Okay, then a nerve impulse is initiated. Okay, a nerve impulse is initiated. The stimulus causes a fall in the potential difference across the plasma membrane. When this fall reaches a certain critical level, it causes an alteration in the permeability of the membrane to sodium ions. This results in an alteration in the concentration of ions inside and outside and a further fall of potential difference until a reversal of polarity occurs. So the membrane is now positive inside and negative outside. Okay, the difference of potential difference between the active and resting part of the nerve causes local electron flow, which causes local electron flow like this. So here you can see the local electron flow is taking place. Okay. And then what happened? Immediately after this activity, the sodium ions are pumped out again and that part of the nerve returns to its resting state. Okay, the difference of potential between the active and resting part of the nerve causes local electron flow between the active and the adjacent parts of the nerve. The current flows through the membrane in the opposite direction to the potential difference across the fiber. Okay, so the fiber acts as a resistance to the current so that the current flow lowers the potential difference, thus making the membrane permeable to sodium ions, which reverses the potential difference as before. These changes are then propagated along the length of the nerve fiber. This wave of change of the polarized state constitute the passage of an impulse along the nerve. Here the same thing is going to take place in the passage of nerve impulse. Here you can see the passage of nerve impulse. Okay. So here you can see the resting membrane potential. So here a stimulus is given. What is happened? So there is a change of ions. Okay. So outside and inside there is a change occur. That means a potential difference occurs which causes sodium ions to enter into it. Okay. And then there is after this state there is an exchange of local electron flow. So what happens then? This electron flow, how many positive charges? 4. So 4 electrons are going to change here. Okay, that means again once this enters here, so the negative ions will go outside. So what happens? This impulse is transmitted to here. Okay, so in this next stage, and again this causes again local flow. Again it will move on to one segment. Okay, like this the passage of nerve impulse is going on in a nerve. Okay, so this is the passage of an impulse along a nerve fiber is going to takes place. Okay, now we will see the electrical stimulation of the nerve. So what is going to happen during the electrical stimulation of the nerve? A nerve impulse can be initiated by an electrical stimulus. To achieve this, a varying current of adequate intensity must be applied. The plasma membrane of the nerve fiber forms a resistance which lies in series with the other tissues. So a potential difference is set up across as the current flows. The surface of the membrane nearer the cathode becomes negative in relation to the opposite surface. Okay. The surfaces of the plasma membranes marked N lie nearest to the cathode. So here you can see the N is placed nearest to the cathode. Okay. And so become more negative, while the surfaces marked with P lying nearer to the anode becomes more positive. On the side of nerve nearer to the anode, so this one, capital A, this increases the resting potential difference across the membrane. But on the side of the nerve nearer to the cathode B, so this one is cathode B, the additional charges of opposite polarity to those present on the resting membrane so reduce the potential difference across it. Okay. So if the potential difference falls below the level at which the membrane becomes permeable to sodium ions, these ions begins to enter the axon and initiate the series of events which we have discussed earlier. An impulse is initiated if potential difference falls sufficiently across any part of the plasma membrane of the nerve cell. So wherever the potential difference falls, how much means to initiate the action potential. Okay. So if the cathode is applied over a superficial nerve, the side of the nerve nearest to the cathode, that means the side of the nerve nearest to the cathode is activated, but the anode can equally cause the initiation of the nerve impulse. Okay. So in this case, it is the aspect of the nerve further from the anode that is activated. Okay. Now, the current spreads in the tissues, so the current density is rather less on the further surface of the nerve fiber than on the nearer one, and in consequence the anode is less effective than the cathode in initiating an impulse. Okay. On some types of electronic operators, the polarity of the terminals is marked. This refers to the polarity during the high peak of current, which is the effective stimulus. The active electrode should be connected to the cathode, which produces a contraction of the innervated muscle with less current than is required at the anode. So this is the way how the electrical stimulation of a nerve fiber which is going to takes place. Okay. Now, so it is having the nerve is having a property called as accommodation. Now we will see that accommodation. What do you mean by accommodation? Means when a constant current flows, the nerve adapts itself by a mechanism. So normally, which is not fully understood actually, to the altered condition. So this effect is known as accommodation. As a consequence, an unvarying current is not effective in initiating an impulse. That means if once the intensity of the current increases, so for that the nerve is going to stimulate. If you are giving still the same intensity, after some time the nerve is not going to stimulate for that same type of current. So that is called as accommodation. So for unvarying current, it is not effective to initiate an impulse. Why means because of the accommodation property. When the current rises, the impulse is initiated. Okay, what we have discussed above, like that. But a fall in current can also initiate an impulse. Okay, but a fall in current can also an impulse. How it occurs means when the current flows at a constant level, accommodation of the nerve takes place, and the potential difference resulting from the current flow no longer affects the excitability of the nerve fiber, which has adapted itself to the altered condition. When the current ceases, the potential difference which it caused across the plasma membrane suddenly disappears. So, altering the total potential difference across the membrane. So, once you stimulate the nerve, what happens? There is a change in the potential difference. So, when you drop the intensity, what happens? Then also the potential difference is going to taking place. Okay, so this altering total potential difference across the membrane again causes a change in the potential difference, which is ready for getting that part of nerve to stimulate again. Okay, so on this aspect, the nerve nearer to the anode, the applied potential difference was augmenting that across the resting membrane, and its sudden loss causes a fall in the potential difference. Okay, if this fall goes as far as the level at which the membrane becomes permeable to sodium ions, an impulse is initiated. So, however, a fall in current is less effective than a rise in initiating an impulse. Although the fall in current is also creating difference in potential difference, but that is not that much effective to initiate an impulse. It is the side of nerve nearer to the anode that is affected in this process. So the anode produces a greater stimulation than the cathode when this current is fallen suddenly. Okay, because the nerve has the power of accommodation, a current which rises or falls suddenly is more effective in initiating an impulse than one which changes slowly. If the variation of current is gradual, there is time for accommodation to take place, and so a greater current is needed to be effective than if the variation is sudden. A current that changes very slowly does not initiate a nerve impulse at all. So this is about the accommodation. Okay, Now we will see the effects of nerve stimulation. So what is happening if a nerve is going to stimulate, which causes muscle contraction? Yes? Yes. So when a nerve impulse is initiated at the nerve cell or an end organ, so there is only one direction in which it can travel along the axon. But if it is initiated at some point of nerve fiber, so for example, if we initiate some point of nerve fiber, so what will happen? For example, so all these combined together as nerve fiber. For example, if you take this one as single nerve fiber, now we are going to stimulate at this part. Then what happened? So it is transmitted simultaneously in both direction from the point of stimulation. So that means if you are stimulating here, so for example, this is the stimulator. Now we are stimulating at this point. So what is happening? It is going to stimulate this way as well as this way. The same thing. So we are going to stimulate the nerve at this point. So the stimulus is going on both the directions. So it has some effect if you are stimulating the sensory neuron and if you are stimulating the motor neuron. Okay, or sensory nerve or motor nerve. So when a sensory nerve is stimulated, the downward traveling, so for example, this is the sensory nerve. If sensory nerve will take impulses from the muscle to the spinal cord, isn't it? So then what happens? If you are stimulating at this point, the electrical impulses will move this way and this way. That means the downward impulse doesn't have any effect, but the upward traveling impulse is appreciated when it reaches to the conscious levels of the brain. If impulses of different durations are applied using the same current for each, it is found that the sensory stimulation experienced varies with the duration of the impulse. Impulses of long duration produce an uncomfortable stabbing sensation, but this becomes less as the duration of the impulse is reduced until with the impulses of 1 millisecond and less, only a mild prickling sensation can be experienced. Okay. Yes. If when a motor nerve is stimulated, the upward traveling impulse is unable to pass. So here the motor nerve. So what is the motor nerve? It takes the information from brain to the target organ, isn't it? If you are stimulating at this point, so the impulse will travel on both the sides, but this upward traveling impulse is unable to pass the first synapse as it is traveling in the wrong direction. But the downward traveling impulse passes to the muscles. So you can see the arrow marks here. Passes to the muscles supplied by the nerve, causing them to contract. Okay. When a stimulus is applied to a motor nerve trunk, impulses pass to all the muscles that the nerve supplies below the point of stimulation. Okay. Yes. Next, when the current is applied directly on the innervated muscle, so we are not applying on the nerve, but on the innervated muscle we are going to apply this current. Then what happened means, the nerve fibers in the muscle are stimulated in the same way. Inside the muscle, some nerve fibers are present, isn't it, which are supplying. So here you can see. So those fibers are going to stimulate in the same manner. Okay, the maximum response is obtained either from stimulation at the motor point, which is the point at which the main nerve enters the muscle, or in the case of deeply placed muscles, at the point where the muscle emerges from under the cover of the superficial ones. Where you get the maximum sensation means once you can put at the motor point, that means the entire nerve which enter into the muscle at a single point. From there it is going to divide and supply the muscle fibers in the form of motor neurons, isn't it? So at this point it can get the maximum contraction of this muscle, or otherwise if any muscle fibers which are emerging out from the superficial ones, there we can get the maximum contraction. Okay, these are the effects of nerve stimulation. Now we can see effects of frequency of stimulation. When a single stimulus is applied, impulses pass simultaneously to a number of motor units, so that in normal circumstances there is a sudden brisk contraction followed by immediate relaxations. So here they have shown only two motor neurons which are supplied to different muscle fibers. Okay. So if a succession of stimuli are applied at rather long intervals, for example 1 stimulus per second, each produces an isolated muscle contraction, and there is time for complete relaxation between the impulses. Increasing the frequency of the stimulus, for example if you increase the frequency of the stimuli, shortens the periods of relaxation until at the frequencies exceeding 20 Hz. So if the frequency per second is more than 20, it decreases the period of relaxation. Okay, so why? Because there is at that time, at this condition, what will happen? There is no time for complete relaxations between the contractions, so that we'll get partial tetany type of contractions. So further increases in the frequency reduces the amount of relaxation still further, until at frequencies over 60 Hz there is no, so greater than 60 Hz there is no perceptible relaxation and the contraction is fully tetanic type of contraction. We can see greater than 60 Hz. Normally this Faradic current also having a partial tetanic type of contraction. Okay, because of that frequency. If you see the strength of contraction, this mainly depends upon the number of motor units activated. Okay, so which in turn depends on the intensity of the current applied and the rate of change of current. So if the intensity of current rises suddenly, there is no time for accommodation to take place and a muscle contraction results. If the current rises more slowly, very slowly, then what happens? As with the trapezoidal, triangular and sawtooth impulses, there is some accommodation and a greater intensity of current is needed to produce a contraction. So these are the effects of frequency of stimulation as well as the strength of contraction. So all these are about the electrical stimulation of nerve and muscle. In the next session we are going to discuss about the physiological and therapeutic effects of Faradic as well as the sinusoidal currents. Thank you.